Picture this. You're in a vehicle with your friends, driving to your destination. You're in a terrific mood because you have the next day off. Suddenly, the vehicle in front of you manages to set off an explosive device. This causes the driver of your vehicle to swerve, overcorrect, and flip. As your vehicle rolls, the vehicle right behind you sets off another explosive device. Next thing you know, you're waking up in the back of an ambulance and getting your vitals checked. After a while, you're released from the hospital. You feel fine, and you can go back to work. As you're on the way, a loud sound is made that is similar to the one from the incident you were just in. It triggers something in you, and you see yourself back in that eventful area. You find yourself scared, immobile, and desperate to escape. This sensation happens frequently, and it gets worse with each encounter. This is what PTSD can do to you. Just like me, many war veterans, after completing their military service, will have the disorder of post-traumatic stress. Earlier years, in previous wars, it had various terms as shell shock or combat fatigue. Today, more doctors and medical professionals identify the issues of those terms as the medical condition called post-traumatic stress disorder. Finding treatment that helps someone with this condition can be very demanding, but possible. Regardless of the situation or circumstances, people who have experienced PTSD should be able to have access for treatment that is most beneficial for them to overcome their disorder. Troops are at risk for post-traumatic stress disorder. However, little is known about risk and resilience in this population. Post-traumatic stress disorder, or PTSD, is a mental illness that is caused from anxiety induced by an emotionally distressing accident or disturbing event. The disorder is affecting more and more Americans every day. An article by Marianne Christensen estimates roughly 15 to 24% of people exposed to traumatic events have experienced PTSD sometime in life. After a traumatic event such as combat, assault, physical or sexually, or a natural disaster, people with the disorder will unfortunately keep re-experiencing the event in their mind. Symptoms of PTSD include flashbacks, hypervigilance, severe anxiety, self-destructive behavior, or social isolation. BMC Psychiatry concluded, among individuals with probable PTSD, post-traumatic stress symptoms vary by the day of the week, with more symptoms on weekdays compared to weekends. Determination of the factors associated with the daily variation in PTSD symptoms may be important for further developing treatments for PTSD. While PTSD can affect anyone from anywhere at any time, the condition in veterans is frequently connected to combat trauma. The Behavioral Sciences Research Center makes note that treatment adherence is one of the major strategies in treating post-traumatic stress disorder in combat veterans. This study developed and psychometrically assessed the treatment adherence questionnaire for patients with combat post-traumatic stress disorder. The disorder has taken a tremendous toll on many war veterans who, at the present time, currently use Veterans Affairs healthcare. This includes Iraqi and Afghanistan war veterans. Psychological medicine stated at baseline, prior to deployment, 3.7% had probable PTSD. Among soldiers without PTSD symptoms at baseline, 13.8 reported post-deployment new onset probable PTSD. Veterans Affairs, often abbreviated as VA, has continued to find and fund research, assess, and treat PTSD. Research includes studies of veterans diagnosed with the disorder, their families and friends, and other soldiers who aren't diagnosed but are around those who are. VA personnel and researchers are further understanding PTSD and the effects it has, elaborating and testing treatments for the condition, and actively finding ways to prevent PTSD from occurring after trauma. Mental Health American has stated, a lot of studies have shown that these treatments can reduce PTSD symptoms, and many people who complete these treatments strive to have no longer PTSD. From the causes, symptoms, and diagnosis, PTSD can happen to anyone. Recovering from PTSD is an ongoing process, and the disorder might never go away. But with continuous treatment, emotional support, and talking to a professional, a person can tolerate and overcome the disorder's effect on them. As a person who has been diagnosed with PTSD for over a year now, I can tell you, it's an everyday battle.